Okay, so again, patellar reflex is sometimes considered L3, but most of the time it's going to be L4. So that's different than the myotome for L4 is not knee extension. Okay? So you want to make sure you sort that out between the difference. And for some reason, I just noticed on here, they don't have a picture of the patellar reflex on here. They have all these other more obscure ones. But the main reflexes that you do in the lower extremity is L4, patellar reflex, and S1, Achilles. All right, so then when we get into palpation, we'll go more over this later. I'm just going to go right into the special tests. So we'll talk about going through the same patterns of doing special tests. We'll talk about the inert tissue first. So that's going to be ligaments and joints, things like that. So hopefully this will work, but I've got some special video. You might recognize someone in this. I don't think we got it turned in time for the Academy Awards, so we didn't get anything. So this is for the sacroiliac ligaments. So you're talking about the ligaments on the anterior part of the sacroiliac? Can you get the skeleton out? So what we're doing is we're forcing the anterior part of the sacroiliac joint to spread apart by pushing this way. All right, so you're stressing the ligaments on the anterior part of the sacroiliac joint. Okay, so you can see you're putting your hand positions on the ASISs.
So is this considered a hip test or
Pelvis. You should be in order there. You should be the first one in the lumbar pelvis. So what we're doing first is lumbar pelvis, and then the hip will be at the end after we do the lumbar pelvis. So I'm trying to follow the same kind of pattern when we're talking about inert tissues first, and those are the ones that are going to be injured from surgery. Injured from acute traumatic injuries. But again, with laxity, joint laxity, sometimes it can be a chronic repetitive type of thing. So basically we're talking about ligaments here on the front. So you can see when we're pressing apart like this, these are getting spread and open. Okay? And then when we're going to check the posterior one, we're going to press like this. And then that's the next one on here. Okay, so you're pressing down here, and that's basically it's spreading these out. As we push here, it spreads this out, so you're stressing those ligaments on the back, posterior SI ligaments. We'll go into more detail of all the hand placement and everything, but I just want to go through this real quick so you can see it. So this quick test is just a quick scan of checking the lower extremity joints. You just have the patient bend down and come back up. Obviously, you have some 80-year-old geriatric patient that walks in with a cane. Are you going to have them do that? I don't think so. All right, now this, the way I do it's a little bit different than the way you see it in the book, where you know, the simplest thing is you can do is you just have the patient come back and touch the back of their knee. Okay? That's a lot of times the way you see it described. If you go like this, then you can put more down pressure on it. All right, so when we talked about before, when you're flexing, you're stressing what usually? What's that? Putting pressure. So flexion is going to be more of the anterior part, so you're talking about forcing the disc backwards. When we bend back like this, what are we compressing here? The sets, right? And then it's just like the same thing as we did in the cervical. You can go straight back like that, or if you go back to the side like that, then we're going to be stressing more one particular facet. And so if you apply extra pressure while they're back like that, you're just accentuating that. So you're putting more pressure on the facet joints. And then the way that's different on here, how I'm doing it is I got I usually put the hand in the back. It's the same kind of thing as if you do in the cervical. If I put my hand back here, it does two things. One is they can control the way the patient's moving, because sometimes when they might move, when you say bend backwards, they might do this. I'm bending at the knees, I'm not bending here. So you can do a little better of isolating exactly how much extension, how much rotation. And then also you say, well, where do you feel that? And you got your hands right there already. You say, okay, where is it? Is it here? Is it there? You know, so, but you can do it, the simplest way is you just say, touch the back of your knee. But, you know, what if they're doing it like this? If I have a hand back here, I can say, no, I need you to extend more. I need you to rotate a little bit more. Either way is fine. And then usually if facet joint problems, we'll talk a little bit more about this later, facet joint problems can go down the back of the leg. So you can get some radiation, but rarely will it go down into below the knee. If it goes below the knee, more likely you're going to suspect what? Well, sciatic. When you say sciatic, all that means is you got pain in your leg. Okay, in general use, the use of sciatica, people say it a lot, but really all you're saying is that you have pain in your leg. Well, we're going to be a little more specific. What's causing that pain in the leg? Is it going to be the sciatic nerve can get irritated in the pelvis. It can come from nerve root problems in the low back. So when you're bending back like that, you're getting pain down the leg, you're going to suspect something more neurologic, like a nerve root problem, things like that, versus joint problems. And then Gillette's, it's a little dark on that one, but we can see this. Here's the thumb on the PSIS, and as the pelvis as the leg moves up, what's going to happen to this side here? It should drop down like that. So as this leg comes up, this side drops down, this side comes up. So what you're doing is you're putting your thumbs on the PSIS, and as they raise this leg, you're watching for the pelvis to move like this versus the other one. If what you're checking for is just fixation or the SI joint that's locked. If you go and you move this leg up like this and the PSIS goes up, that's reverse motion, so that's just an indication that there's a problem. Okay, then so you have the double leg raise. And what I'm doing there is you put your hand, if you can do it, it's kind of hard if you have a big patient and your arms are short, but if you put your hand back under here, feeling across the different joints, if you're feeling the SI joint and the lumbars, as they first start to move, you're getting movement into the SI joint, and then as you go farther up, then the lumbars start to move. When you get up into that position, up into here, the pelvis has moved, and then you're starting to get reversal of the lumbar lordosis. So this isn't really a nerve test, it's more of a joint test. When we talk about the single leg raise, then we're talking more about neurologic stuff. Okay, so then this is Gainsland's test. Again, we're still talking about in nerve tissues and joints. What we're trying to do here is hyperextend at the SI joint. So here's a way that you can do it while the patient's supine. So you're hyperextending at the SI joint right there. And then this is the way that you do it while the patient's seated. I mean, sideline. So you can see you're bringing that leg up, then you're extending at the hip. So you're looking for SI joints on the back part there. So what else could be stretched when you're doing that position? What nerves did we say can be stretched with extension? Yeah. So there's another test that's almost the same kind of thing that we're going to do for femoral. So there you're paying attention to where the pain or the symptoms are. If it's back here, if it's right here, what are you going to suspect? SI joint. If it's right here, what's that going to be?